all the, I'm sorry. I'm sorry. They just turned on the recording for us. So you all, please feel free to accept. And I will continue to move on, as I was saying about the concepts that we covered. So the last one that I wanted to speak on is from a physical and spiritual perspective, that we all are doing either walking or doing something physical to relax ourselves. And then from a spiritual point of view, we're either seeking religion or practicing some other type of mental wellness, whether it's through meditation or through something like hot yoga, because I love to do hot yoga. So I'll share that one with you all. Certainly doing hot yoga at the end of every session, they use the term namaste. I acknowledge the spirit in you, or the divine spirit in you, and you acknowledge the divine spirit in me. So I just wanted to speak on those three, and I'll let the rest of the team continue as we will go through the other concepts of mental health first aiders, and concepts that we will learn more about as we hear from our other colleagues that are on the line. Thank you for allowing me to speak.
Okay, thank you, Michelle. Thank you so much. I don't know why my camera is not working for whatever reason, but I just want to turn it over to Brighton. Now, Brighton is a case manager. She also went through the training as well. So she's going to be really brief. And then we're going to turn it over to the professionals that can elaborate on some of the things that have been brought up about the mental health issues that are that people have because of the pandemic. So go ahead, Brighton.
Hi, everyone. I'm Brighton from the Quad County Urban League. I'm a case manager, as Barbara said, and I have a background in psychology. So that's why I was interested in continuing the conversation about mental health. So I will be discussing the Algae Plan, which is an action plan that they provided us in our training. So I'm going to share my screen really quick so you can see a graphic of the acronym. Oops. Okay. Just a second. Okay, so is that clear for everybody?
Yeah.
Yes. Yes.
Okay, good. So in the mental health first aid training, they provided us with a bunch of different action plans, as Michelle explained. And so they can be applied in a variety of different situations or environments, so that you have a step-by-step action plan to use when providing support to someone that might be in distress at work or at home. So this action plan is nicknamed Algae, and it has 5 steps, which can be used in any order based on the situation. So the first letter is A for approach, and assess for risk of suicide or harm. So trying to find a suitable time or place to start the conversation with a person while keeping their privacy and confidentiality in mind. So if you feel that the person does not want to confide in you, then try encouraging them to talk to someone that you know they're more comfortable with. And then the L is listen non-judgmentally. So many people that are experiencing a challenge or distress would like to be heard out before you actually try to help them. So rather than interrupting them to provide whatever information you have to share, just try to be empathetic and put yourself in their shoes and allow them to fully get off their chest whatever it is that's bothering them, so that they feel that you understood the situation that they're in. G is give reassurance and information. So after someone has shared their experiences or emotions with you, then you should be ready to provide them with any resources or useful facts that you might have. So an example of useful facts might be helping them see a situation from your perspective or from another perspective, because sometimes having just your own perspective might make the situation seem worse than it actually is. So helping them put themselves in your shoes might actually help them to see that the situation is not as bad as they think it is. So E is encourage appropriate professional help. So the earlier somebody gets help, the better chances of survival and recovery for them. And it's important to allow them to learn about the options that are available to help themselves and to help others. And then the last E is encourage self-help and other supportive strategies. So this might include helping them identify their support network, programs within the community, and creating a personalized emotional and physical self-care plan. So that could be meditation or yoga, or even counseling. But overall, the training likes to emphasize that it's important that we don't try to diagnose anybody, because we're not actually mental health professionals. So rather than trying to diagnose them, simply apply this plan or any steps in this plan and try to help them with whatever resources that you have, as much as possible. But if the situation seems urgent or dangerous, then you'll want to call 911 rather than trying to de-escalate the situation on your own. But in non-crisis situations, then this plan is perfect. But regardless of the circumstances, you should try to remain calm, because if you're freaking out, then the other person is not going to be able to get any help from you. So yeah, that's pretty much it.
Okay, Brighton, thank you so much. And as you spoke about it, you brought up a good point. All those things are geared toward having professional help. And that's why we have the people that we have on our panel today. These people here are professionals, and they are the ones that can really assist people in the way that professionals can. The first person I want to bring up is Dr. Tawana Edson Steiner, and she is a licensed clinical social worker, and she works in the mental health field. She's been in that field for approximately 20 years in various capacities. She works in inpatient behavioral health care, supervising doctoral externs, oversees the psychological evaluations for accurate diagnosis and treatment. Now, it's a table talk. So we are going to listen, we're going to interact, we're going to ask questions. But again, these are the professionals that can tell us what they've seen, how they've assessed things. And there's 3 areas that I want them to answer as they speak. When there's mental health issues in our communities, one of the questions we want to ask is like, what barriers do people have when they're trying to get the help that they need? Another question is, what are the possible solutions for people that have mental illness? And another question would be, who are the trusted individuals that these people go to for that assistance? And hopefully the professionals in our panel will be able to answer each one of those and how they are talking about their experience and give examples. And if you have any questions, I'm sure they'll be more than happy to answer while they're speaking, but definitely they are the professionals in this field. So I'm going to turn it over to Dr. Tawana Steiner.
Okay. Hello, everyone. Greetings. And yes, same as someone else. For some reason, my camera isn't working.
Yeah, mine's not either.
So I'm not sure why that's happening. But yeah, so actually I'm a licensed clinical psychologist. So, somewhat, well, different than a social worker. Social workers really I would say, heartbeat of the community, very resourceful, connecting all the different multidisciplinary pieces together frequently, whereas I focus more so on specific diagnoses, various diagnoses. And in my current position, I work in a inpatient behavioral health treatment center. And as Barbara stated, I supervise doctoral students on psychological evaluations. And so what we've been seeing in the past 2 years, I would say since the pandemic, is definitely an increase in the complexity of our cases. So we would definitely still get, the general anxiety and depression and things of that nature. But with our qualified staff members, most people, are able to tell the difference between, depression, anxiety, and things of that nature. So they come to us when it's very confusing. And so what we've been faced with are these complex, convoluted cases. Most frequently, they are adolescents all the way through young adulthood who are presenting with overlapping symptoms. And in particular, most of our referrals are actually ruling out autism spectrum disorder. Anybody familiar and work with folks on the spectrum? I can only see certain faces, any hands, or maybe in the chat. Okay, all right. So what we're finding with this population, it seems that due to the potential, the unpredictability, and basically all of our lives were disrupted from the pandemic. And those are on the spectrum really crave for predictability, sameness, things to be structured. And so while all of us was definitely faced with a lot of stress with the pandemic, those on the spectrum even more so. And so we all know that if a person is diagnosed with a mental illness, that opens the door to more potential risk factors. And so that is also true of folks on the spectrum. And so the young people that I'm speaking of are not those traditional people that you would see on TV, depending upon our age on the panel here, not, the Rain Man person that we saw, years ago, more so like the Elon Musk presentation, the Bill Gates presentation, higher functioning Asperger's type of folks. So that's why they're not getting diagnosed till later, because again, they're presenting as pretty okay, very functioning in many aspects, but then there's areas where they're suffering. And so what we're seeing is, the anxiety within the diagnoses, the depression, increase in obsessive compulsive thoughts, and even more concerning, a disruption in the thought processes. Not necessarily, so oftentimes we're asked to rule out if it's autism or if it's psychosis. And most frequently, it seems like it is a foundation of autism. But what's happening, not just for folks on the spectrum though, but more so it seems like for them, is again, this disruption in thought processes, where the reality of the external stress is so confusing and so overwhelming that they're having difficulty processing and assimilating it into their own understanding of their internal processes, if that makes sense. So, for example, trying to think of an example. If a person is anxious about school and the anxiety is very high, many people can say, oh, it's about school and this is what's bothering me. While some kids on the spectrum can say that as well, sometimes their perception of the stressor is quite different. Or sometimes they can be more suggestible to certain stressors, such as believing certain things on the internet are true. And so maybe having thought processes to suggest, this false character is coming after me, or I think I'm seeing something in the shadow, or not recognizing that some of their symptoms are a part of their own selves, but instead they kind of compartmentalize it and think it's maybe an alternative personality, if you will. Like, oh, this is not me because, I'm this person who does A, B, and C, not those things. So anyhow, the good thing about it is that there are many people coming into treatment. We've been very busy. And as I think about the people that I service, and it is a community that's probably middle class to upper middle class and higher, private insurance. As a person who has a history of working long-term with a community mental health and those who have less resources, I can't help but to think about the marginalized populations, right? So when you have private insurance, hey, can you come assess my kid? And, let's try to figure out what's happening. There's not as many roadblocks. So to go into your first question, some of the barriers. So when we talk about marginalized populations, there's many barriers. And so we're not just talking about race, we're talking about income. We're talking about folks potentially in the LGBTQIA community. We're talking about neurodiverse thinkers, such as those on the spectrum. And so when you don't have enough resources in your community, or the resources are so crowded and overloaded, and it's taking you, for example, when you do reach out to that person and when you're in a crisis, but the wait list is 3 weeks from now, a lot of times the motivation decreases by then and people lose hope that way. So sometimes, there's a lack of resources. The other barrier is a lack of education. So again, at this point, marginalized populations. Oh, okay, I'm looking at my code on the thing. Okay, I thought maybe it was someone raising their hand. So in some situations where you have people also who have difficulty differentiating between normal stress reactions, such as all of us have had stress reactions during the pandemic, versus when then does it become an issue, And so normalizing someone staying in the bed for 3 days, or normalizing consistent tantrums, because that's just how they are, or, their parents spoil them, or what have you, or they're just bad. That's why they're always disagreeing with me. So a misunderstanding of what's normal behavior, and then when it becomes a problem. So education about mental health symptoms. And I'm also thinking about, some of our populations are marginalized populations are raised by maybe grandparents or aunts or aunties. And if that grandmother is providing wonderful basic needs, but again, if in their culture, if it's not the norm to seek mental health treatment or even to recognize that this is a mental health problem, you may have the response being, well, let's just take them to Bible school and make them sit there for an hour and let's see what happens, or that's all they need to do is play basketball. He stays in the house too long and you're babying him on, in the video games too long. So you're misinterpreting those behaviors, and then they're doing things that they think would be helpful, but probably are more maladaptive, and it's going to create more anxiety and exacerbate potentially some of the symptoms. So resources, a lack of psychoeducation, and then also let's talk about the bias and discrimination, right? So who wants to admit that they are clinically depressed? People would prefer to potentially self-medicate. People would prefer to ignore it. People would prefer to do whatever they can to try to manage it because it suggests vulnerability. And if we're honest, our society does not necessarily support vulnerability too much, right? It's about being strong, it's about going to work, and it's about us being able to just pull up our bootstraps and do what we need to do to get through it. Yes.
Juan, I have a question about that topic right there, because one of the things I learned about the different cultures is that in America, we have the whole individualization, right?
Yes.
And talking about what you just said about being strong and about, pulling up my own bootstraps. How does that fit into, and any of the panelists, how does that fit into recognizing if you have mental health, or there may be a mental health issue, or just even in your child, maybe that it's not that they're not able to pull up their own bootstraps or be individualized, but they may have other issues.
Exactly. And I think that's difficult to acknowledge, especially for certain communities when we have been discriminated against
Hmm.
from the beginning, and now you want me to express an even more vulnerability. And do I trust my doctors? So going into that second part, another answer to the question.
Mhm.
So hopefully what happens is, and definitely what has happened in some of my work, is representation matters. That's something that we've been hearing. And I do believe that when that person who has been so used to just getting through things, and they finally come across and sits across to someone who kind of looks like them, they're a little bit more willing to let their guard down. They're a little bit more willing to be honest about what's going on. And then they may be more willing to trust our feedback and recognize that that's valid. You've gone through a lot. You
Mm.
said your mother died, your brother died, and you're a single parent. Wow. I can understand why you're not sleeping.
I want to bring Sarah into this conversation because I know that she manages Nami of Kendall
Yeah.
King County. I'm sorry, and deal with a lot of our teens in that. And I'm saying teens. I'm not sure who your population is. Maybe you can tell us that.
Sure. Hello, everyone, and thank you so much for inviting me to this important table talk. I'm honored to be included. Tonight I'm wearing two hats. So I'm the executive director of Nami KDK, which stands for Kane South, DeKalb, and Kendall County. And the population that we work with is pretty much all of our community members that either have a mental illness or care for someone that has a mental illness. So family members and caretakers of someone that has a mental illness. NAMI stands for the National Alliance on Mental Illness in Kane South, Kendall, and DeKalb County. And we're the largest grassroots mental health organization. And we provide free mental health resources, education support groups for individuals and family members and communities. And majority of our support groups are for individuals that are 18 and older that have a mental health condition. And so we have what's called NAMI Connection and Recovery. So that group is for individuals that have a mental health condition that are 18 and older. We have NAMI Family Support Group. So that's for a caretaker or a loved person, a parent, or someone that's caring for someone with a mental health condition. We have a BIPOC support group, which is for Black, Indigenous, and people of color, so that it's a safe space, kind of like what was raised tonight, that you can be with people and share your thoughts and feel heard and feel safe. We also have Spanish support groups. And then we have a family-to-family course that is a free 8-week course program for family and significant others and friends of people with mental illness. So those are the services we provide, and we're offering them during the pandemic. So we're doing a hybrid approach. We do them in person or through Zoom. And if you go to our website, you can register, and the support groups are offered 2-4 times, and the other group for BIPOC is once a month, and the Spanish support group is once a month. We also do community presentations and education, and we do NAMI in our voice, and that is from someone that speaks from the perspective of someone that has a mental health condition to break the stigma. And then we have Ending the Silence, which is about suicide prevention. And we do those in the junior high and high school. So that is for students. So those are the services we're currently doing during the pandemic. And then we have a helpline. So we have a phone number and a helpline that people can call. And then we email also resources out in the community.
Awesome.
We're basically a nonprofit that is supposed to be for a service gap. So, obviously we all encourage that people go to the mental health professionals to seek, professional help. But as we know that you have scaled down they'll go from like once a week to once a month, and they'll need support in addition to their therapy.
And what is that? What is support in addition to therapy? I'm not sure where I'm getting the feedback
So
from.
so the second hat that I have is that I'm a parent of an adult child that has been diagnosed with bipolar. And when my child was diagnosed, and I was kind of mourning and struggling with acceptance, her therapist actually suggested to my husband and I that we look into our local Nami, and that's when I started attending family support group, and that's kind of when I met my tribe. And from group wisdom of how to navigate our healthcare system, learned things like special trusts, how to protect money, how to provide for my child and plan, our assets when we pass, and how to take care of her in the future. And so those are things that when you learn from someone that's been through the journey, that has been doing this, that is just knowledge that you can't even give a value to, right? Because I mean, I've never had a family member that I've known intimately, a friend or a neighbor that I've ever met that's told me, oh, I have someone in my life that has mental illness. So I arrive at the hospital in the ER, and I don't know what to do. And I have private insurance. I still don't know what to do, right? So I just asked for help. And, you know, that's, if I have one thing to say, is to advocate, to raise your voice, to ask for help, to learn how to use the resources, because there's really no map or guidebook on how to navigate the system.
Thank you. You know, I think that brings us into a great segue to Ms. Randy Coley, who works for the Department of Human Services. And because I was actually trying to put a note in the chat.
I was just ready to bring her up. Yeah.
Says learning how to navigate the healthcare system, advocate to raise your voice. I think that sounds very important. Go ahead, Barbara.
Yeah, I was just getting ready to introduce Randy, because just based on what Sarah was saying, I believe Randy can probably provide some information concerning that, with her helping people in the community and definitely dealing with people all day, all long, with many, many different types of mental health issues. Randy she's a LCP, I think. Yeah, she's LPC and a CADC. And with her being with the Department of Human Services, she has had the opportunity to really be involved with people, you know, daily. So if Randy, you want to speak on, you know, kind of piggyback off of what Sarah was saying, as far as those issues that people have, and maybe lacking the support that they need. Randy? 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 Hope we're not having, oh, Randy. Randy, can you hear us?
Yeah, she's muted. Yes, now she should be able to hear her.
Yeah. Randy?
Right. Is she muted from the host?
No, I think she's just having technical difficulty.
Well, until she gets that straight away. Minister Larry Crawford, I want to go to him, because he is a minister, but he's also a truancy specialist. So he definitely works with kids in Region 7. So he has had the experience and seeing a lot and being part of a lot. So maybe Larry, you can kind of interject there and talk about your experiences and the barriers that you see with the kids that you work with.
I don't know if I can or not. They're just, what has been shared has been so useful to me, where, you know, we start talking about self-care action, and I don't know how to say, is it Britton or Brighton? How do you say your name?
Brighton. Yes.
Brighton. You know, it seems like the very practical things that I'm learning how to do is being able to approach a situation and being careful not to act like I understand, and until they feel like they're understood. And I think that's one of the biggest emphasis that I have, is I want to be a great listener. I've been in education for a bunch of years, you know, probably more years than Brighton's been alive. You know, and I don't know why you guys wanted this old senior citizen at the table, but I look at all of those alphabets, Dr. Steiner. I think it is. Is that right?
Yeah.
Anyway, and I look at, you know, ADHD and EDs and all that, all those kinds. I'm a behavior specialist by training, but I ended up in truancy because I didn't really want to be in the classroom. But all of those alphabets are almost very often preconceived notions that's based on somebody's limitations, and so I've got this silly maxim that says we talk about TDs, EDs, ADHDs, but we don't say a whole lot. I put it in there, but we don't talk much about TDs. We want to talk about LDs, which is a learning disability, but we don't talk much about teaching disabilities, which means we look at a situation, and because I'm not able to figure it out, I tell you that you have a problem. And so that's as a behavior specialist, I'm learning to be careful to do that algae kind of things, and to do the self-care kinds of approaches with that. As I dealt with children, as a truancy specialist, my focus is that truancy is an adult issue, because we're looking at a situation where parents are saying, I can't make little Larry go to school, you know, and I was hoping Miss Randy would be able to chime in and really offer me some relief in that, because part of that notion is that I don't know what my rights are as a parent. I don't know where to draw the line that separates discipline from abuse as it can so quickly. My kid, I was going to chastise her. I was going to discipline him, and he told me he would call the police on me. You know, and I said, wait a minute,
Right.
For parenting, you know. And so when you start talking about some of the stress that goes along with that, it's a real challenge. And then there are just additional things that are related to that when you start talking about the circumstances, whether it's income, whether it's race, whether it's some of the newer identities or education. And sometimes it's all of those things combined that a family or one person is dealing with. And if we don't know how to just kind of separate those things or address them, then you're talking about somebody who's spinning plates, more plates than they've got hands to manage, you know, and that's certainly a mental health issue. I think I'm kind of drifting off in terms of what your theme might be, but I do look at some dynamics that contribute to mental health or in some sense, and that's what I find myself dealing with when I deal with adults and children. So I'll park right there, and there's some other things that, you know, I'll probably share as we go along. Because you introduced me as I think Reverend Larry Crawford, and And so
Minister.
Minister.
Yeah.
Yeah, which is true. So yeah, in the economy of that place, then there are there's certainly a lot of hope and resources that can be offered to somebody who's kind of distracted by the issues of life.
Now, Randy, can you hear us? You still can't talk? She said she can hear us, but for some reason we can't hear her. Randy?
Did she try going all the way out and coming back in? You know, just leaving the table and.
Yeah, try that, Randy, because we definitely want to hear what you have to say concerning probably what you see on a daily basis. So yeah, if you can maybe leave and come back, because I tried that, but my camera still doesn't work, but maybe that'll help you be able to be heard.
She says she will do that.
Okay. Okay.
There's a great deal of value that I think the workshop that you guys started off describing, and some of the things, the emphasis that it focused on, that's just very, very, very necessary in terms of being relational as opposed to being positional. Because you know, if we go off in there acting like we have the answer, you know, when you start talking about that algae report, listening and being non-judgmental and all, that is such a valuable piece when you validate somebody's humanity. And you know, and then there are those of us who think that we don't have any stress or strain, for lack of a better term, we don't have any mental illness as it may be, but we live in a culture that's having a difficult time just defining all people as human beings. So when you look at that part of it, then that's something, that a filter that I have to work through, so that I don't take my prejudices or my whatever it is, my offenses into a situation where somebody needs some relief.
Yeah, good. And one of the questions I want to throw out there, and I kind of brought it up in the beginning, but and everybody can have an answer for this, because I'm sure everyone has seen or experienced some type of barrier as far as people getting mental health care. So individually, can you guys speak on that? Maybe I'll start with you, Dr. Steiner.
So yes, barriers, again, the resources, depending upon the community that you live in. As a person who's worked both in the city and suburbs, recognizing that in some suburbs, the access might be closer, easier, you know, because it's not as heavily populated. You don't have so many people trying to access the same building where everything is located. So again, you know, where is the building to receive mental health care? And is it in my neighborhood? How long would it take me to get there? If there's only one car in the home, you know, that can be a barrier. Again, like I said, the stereotypes and bias against mental health, and the stigma that comes along with, oh, you're seeing a therapist, or you're taking that medicine, and whatever preconceived notions or prejudices people may have about mental illness, you know, makes people reluctant to go get help. And then you have, again, cultural factors. Some people who do not believe in medication, you know, they'll want to go the natural route, so they don't take it. Again, and so Reverend Crawford, when you talk about just the state of our country and the barrier of trusting the government and trusting, you know, someone who may be presented as someone who's against you on TV. I'll never forget this young male who's Black, who's presenting with several symptoms. And most of his treatment team was white, and he got along very well with them, and we all treated him very well. And in the midst of psychological testing, he presented with some paranoia and anxiety. And within us discussing different things and trying to calm him down so he can complete his testing, he looked at me and he says, "Do you trust white people?" And that stopped me in my tracks because I was not prepared for that question, or recognizing, as you said, Reverend, the layers upon layers upon layers that certain populations might be struggling with in addition to their mental illness, is another potential barrier. So with this young individual, not only was he a young person struggling with his mind, doing his own thing, he's in the midst of a pandemic, and he's also in the midst of this social justice activation. So all of those things being considered, and I think about during ISIS, this was some years back when people were coming into people's homes, due to people who, if they suspected that folks were not here in the United States legally. And so our Hispanic youth mentioning that they were afraid to bring up their concerns in school because they didn't know if they could trust their teachers, and things of that nature. So there's many barriers from, and again, psychoeducation. So again, like you said, when do you recognize that it's a problem versus, oh, she's just nervous, or she just had a nervous breakdown, or that's just because whatever reason that we may attribute to behavior that may seem different, opposed to recognizing, well, that's actually a symptom. I actually think about oftentimes, like in Black communities, labels that we use, he or she is bad, nervous breakdown, mean, bitter Black woman, and it's depression. How many of you all know a family member who may be described as that mean, complaining woman? And it's like, well, chances are that person has been clinically depressed for years. Mm-hmm. Yeah. But we don't acknowledge it as that, and we don't validate that, and we just label it.
And I was, as you're talking about trust, I was deliberate in pulling up some information that identifies, it's probably a couple of years old, but it talks about institutions Americans trust most and least.
Yes.
What would you guess was the most trusted institution? Anybody?
The church. That's just a guess. The church?
Oh, that's a good guess, but no.
Government?
Somebody said government?
Mm-hmm.
Good guess. Good guess. Wrong. Wait.
Yeah, that's
School.
What is it?
School.
Schools. Ah, interesting. Wow. Yeah.
Yes, that's the safe space.
Well, but that's not the one. That's not at the top of the list.
Friends.
No, that's, gosh, I don't even think that made the list. And it's probably a good answer. Somebody
What
said
about home?
home is not on that list, but that doesn't mean that it's, because I think if somebody would be at the top of the list when you say a friend's home, I think that's like, I trust myself kind of thing. So that would probably be above all of those, maybe not. But the military is listed as the most institution most trusted by Americans. Where and somebody said government. Guess what's at the bottom of this list of about 12 things? Congress.
Mm-hmm.
Yeah. Church is about halfway down. Public schools are further down than the church. Television news is right just above Congress. It's next to the bottom. But the military, the top five, the military, small business, the police, the church, organized religion, and the presidency are the top five. After the presidency is the Supreme Court and the medical system. But it's interesting, if they were to ask, if you were to ask me to kind of list them, I think if this, not, whoever compile. It's a Forbes survey, for lack of to identify. Oh no, Gallup survey. That's who did this. So we're talking about it's a Gallup poll, so we take that to the bank, you know, kind of thing.
Right.
But it certainly identifies where we place our trust. But so when we start talking about mental illness, gosh, I'm dealing with a situation now where a mom is just distraught about her son who's in the military, who's dealing with some tremendous mental stress, mental illness, the stress of the military. And it's, you know, he's attempted suicide a couple of times. And he don't know how to take it. He don't know where to take it. Now, here we're saying that the military is where Americans place their trust. He's in the military and he don't know how to go to his superior officers and tell them what his situation is. And I only say that in the context of the depth of how prevalent mental illness can be and how private it is. Because it's embarrassing. I ain't gonna tell you I'm crazy. I say that with all due respect. I say that with all due respect. But you know, I don't want to tell you that I have a problem. And there's a maxim that I share is that you don't hear the fall, you only hear the crash.
Wow.
So,
Well, thank you, Mr. Crawford. I want to turn it over to Stephanie a little bit. I haven't heard from Stephanie. Stephanie, you are a LPC and a WCC, right? And I know you work, huh?
Yeah, go ahead.
Okay, and I know you work, you know, with Sarah a lot, and you do a lot of counseling because I know you're kind of hard to catch up with. But if you have some opinions as far as even what Mr. Crawford was talking about, like what do you see as barriers, or what do you see as solutions to help our community, you know, deal with these things?
Well, first of all, I want to just thank you for inviting me. I think this is a very important topic, something that I talk about all the time. So actually, I'm a licensed professional counselor. And in addition to that, I'm also a doctoral student in a counselor education and supervision program at Walden University. So I wear several hats, and my research is in racism, disparities, and mental health, the strong Black phenomenon. So when you talk about that angry Black woman, those are some of the things that I look about and just doing research. So some of the barriers, I'm kind of in between two counseling agencies. So I provide services in Oswego, and I also provide services in Bolingbrook. And in Bolingbrook, all of my clients are African-American or Latino. In Oswego, 95% of my clients are Caucasian. So I see a big difference between the two. When I'm counseling in Bolingbrook, when people come on camera, because it's all telehealth, they're so relieved when they come on and they see my face and they see that I'm African-American, and they open up immediately. Okay, Oswego is different. They come into the office. I'm right now seeing a lot of adolescents and a lot of couples. That's the bulk of my caseload. The barriers that I see, especially in Bolingbrook, telehealth, I've seen childcare, mistrust for healthcare systems. What else? Culturally competent counselors. Just understanding the story. Even when I'm working with Latino populations, I'm a marginalized individual. So although I don't look like them, they feel great with expressing themselves to me.
Okay, well, that's good. I mean, that you provide that comfort for them, because, you know, just going through meeting with people with those mental illnesses or just mental health issues. I remember in one of my classes in college, one of the things that this young lady said, and it was in my psychology class, and I'll never forget it. She said her brother had just been diagnosed with a mental illness. And one thing he said was, he said, I would rather have every bone in my body broken than to have a broken mind. And that just always, stayed with me, because you think, bones eventually heal, but when you go through the mental illness, that doesn't seem to heal, and you can be medicated or whatever, or go to professionals such as you guys, and you wonder, like, how much, where do you help take that person to, and I don't know if it's constant counseling or medication. And maybe what medication does is it minimizes a lot of the symptoms. So, and maybe you guys can, speak on that. Maybe Dr. Steiner, you can talk about, being a doctor. I'm not sure. Do you like prescribe medication are you able to do that? Because you're not a medical doctor, but are you able to prescribe any medication?
Right. No, I'm not. However, there are, by the way, do I have a feedback? Are you guys hearing me twice or no?
No, you're fine.
Okay, because I had to log in through my phone and my computer to show my video. So no, I do not prescribe medication, but there are psychologists, in certain states that you can get additional training to do that. I do not have that licensure. So you have psychiatrists, you have physician's assistants, you have nurses who have specialized in training for mental health care who can provide that. And so, yes, it's a continued help and support in what we would call protective factors, right? And I look at you, Miss Stephanie, and as a parent, and Nami, and I think about, I also do contractual work with the nursing home. And so I have an older adult who can't wait to get back into Nami, because Nami down the street in DuPage County was a protective factor. It's some place that he could go every week or every day, and then have people have that, living room discussion that takes place. So, I mean, this can go on for hours, as far as like ACEs and adverse childhood experiences. And so when you add all of these negative childhood experiences up, then that wall becomes heavier, and all those bricks that you have to knock down becomes even more. So then the thing to do is to, build up protective factors. And so that would be a quality treatment team, culturally informed therapist, family members, of course. So encouraging parents or family members who recognize that this child or young adult may be suffering from mental illness for the rest of their lives and may struggle with taking care of themselves on their own, giving them resources for case management, and then how to become that person's guardian. The other thing is recognizing the strengths, right? So we talk about mental illness and nobody wants to be taught crazy and but what about the resilience? What about them continuing to show up? And then those who, I can't imagine, can you imagine thinking of wanting to die just as much as you think about eating?
I watched the S Word, the documentary last night.
Mm-hmm.
And it was phrased, a man that had tried to commit suicide, his brother whispered to him, "What will make you stay?"
Yes. Yes.
Not if you want, like, oh, are you having thoughts of wanting to kill yourself? And it was like a light bulb moment of like, what's your motivation to be in this weeds and do this fight?
Exactly.
What will give you that
exactly
bolster? So
exactly, what are those important values? So we talk about values a lot of times in sessions and in treatment. A value can be something as small as a little bitty puppy that weighs 5 pounds, and this is the reason why I stay. It could be that I'm helping raising my grandkids. It could be that I need to take care of this house that I worked hard for so much. It can be whatever, but being able to tap into that when we are working with families and individuals. You know, I know it was hard for you to show up, but what made you show up today? And congratulations, thank you. And thank you for trusting me and allowing me
Hello, everyone. Can
to
you hear
help
me?
you. Yeah.
This is Randy Coley. Can you hear me?
Oh,
Yes.
yeah, we can.
Yay, Randy.
Yeah, Randy is, like I said, she is a counselor. She is so many things. She's a LPC or LC, what is it, LPC?
LPC, CABC, MHS, yeah.
And a
Lot going
CADC.
on.
Okay,
Yeah.
so, and I'm sure you've had your experience working, you know, with individuals, not just minorities, but people, you know, all over, but also tell us a little bit about what you see the struggle is with people getting the proper help. I know as Department of Human Services, that's what you guys do. You do referrals and you provide assistance and resources. Where do you see the struggles or the lack of, you know, availability for people that are in dire need of those types of services?
Well, I currently work in Chicago, so I work on the South Side. And one of the things that is the most stressful for people who are looking for services is the distance between, you know, their home and where they're going for services. And the fact that if they don't have private insurance and they're a Medicaid patient, Medicaid pays the bare minimum and they can take up to 2 years or so to pay. So imagine needing services and you're going to a counselor and they say, you know what, we haven't received payment, so we're going to have to put your services on hold. And then to find out that it can take up to 2 years for them to pay. The state can take up to 2 years to pay. And so that is one of the things that we find with clients, and the fact that even in this pandemic where the CARES Act is in effect, so everyone gets medical that applies for medical that is, you know, financially unable to have private insurance. Everyone is approved, but you still have to work within the guidelines of the system. And unfortunately, it can be a daunting system. We also have people that, unfortunately, with the income barriers, they still are required to pay like a copay of maybe $5 or $3 or whatever, and they don't have it because of the pandemic. A lot of people are out of work, and you'll find that doctors will turn them away for that $3 copayment. Psychiatrists or psychologists will turn them away for that $3 copayment if they can't make it. We've seen that happen as well.
So then what? Then what do they do?
It's difficult because even there was a time when people who were indigent could go to Cook County for psychiatry or counseling. It's very difficult. Their waiting lists, I hear, are 6 months to a year long. Some are even longer than that. So depending on the psychiatrist and the fellowship that they're looking for, the particulars, it's one of the conversations that I had with our administration is that we are offering people the bare minimum and they need the maximum. And when I said that, everyone like stood still for a minute, like, what did you say? I said, we're offering them the minimum and they need the maximum.
Yes.
And during this pandemic, you're finding so many people who are struggling because, of course, you can busy yourself all day long, but if you're not doing self-care, you're not able, you know, you've got a house full of children and you can barely feed them, or you're worried about being evicted because you've lost your job, you're not thinking about whether or not you can sit down and journal today, or whether you're going to, you know, have a glass of wine, which some people say is helping them. I think that's not helping, but, you know, or whether or not you can watch a funny movie because you're worried about if your lights are going to be turned off, And we make those referrals. We tell people, okay, you can go to this agency, you can go to that agency, but they're jumping through hoops to get this help that is still the minimum. And that is another anxious or anxiety-filled concern. Because if we're giving you the minimum, okay, we'll help you pay your rent this month, how are you going to pay it next month? They still have that same concern. And that is a problem where they've got to worry about what to do now. So, you know, we make the referrals, we send them out, and those are barriers, income barriers, you know, the overcrowding of the system barriers, where you are in a smaller community where all of these people need all of this help and the funds are limited. And who you turn to? You turn to your minister. And with mental health, a lot of churches tell people they don't need counselors. You know, there's a running statement, Black people don't go to counselors, they go to church. Have you all heard that before?
Yes.
Of course.
So imagine, you know, you've got churches are the largest organizations in most communities, poor communities, wealthy communities, whatever, and you have ministers who will tell people that, oh, you don't need that medication, you don't need to sit down and talk to that counselor. Hey, you know, we got you, we'll pray for you. And believe me, I believe prayer works, but some people need that medication and they need somebody outside of that room to talk to that's going to offer them a greater ear, you know, without bias, without our own ideas.
And you're also, Ms. Randy, you're talking about that trust level that's so important there as well.
Yeah.
Yeah. So my thought is, and it's just really quickly, is then if for me, so what I've done for myself during this time of the pandemic, and again, working in a different community now versus the inner city where I used to work, recognizing everything that you just stated, Mrs. Coley, without me even being there, is then reaching out to the people I know at the churches.
Right.
So,
well, I
when
mean,
yeah.
When you talk about mega churches, you know, a lot of people go to these mega churches, and you may have 10 people, you know, in the whole church, and those people may not be the people that can help you. They may just be able to say, hey, I heard what you said. But there's a greater length of reach that needs to happen.
Right.
Because if you have a building with 10,000 people, and only out of the 10,000, 50 know the pastor for, you know, individually, and then there's these tiers and levels of people who you have to go through to talk to, and you know, you do need professionals. I'm not saying that ministers cannot counsel you, they can. I just don't think it's on a level that some people truly need. You know what I mean? There's a professional level that has to take place for some people who are severe, who have severe mental illness. And I have 2 siblings, and I can speak for one of them who's passed away. She was severely schizophrenic. She would not take medication. She heard audible and saw visual hallucinations. And it didn't matter what we did for her. It didn't matter that we got private insurance for her. She saw a psychiatrist. She saw a counselor. It didn't matter what we did for her. There was no help available for her because she couldn't hear it. She wasn't able to we couldn't break through that wall, that barrier. She was totally out of body. And she did not take her own life. She died due to a unforeseen situation, but she was very bad off at the end.
But maybe, Dr. Steiner, you can kind of speak to that. What does someone do when when that family member just can't turn it around with the help that they need? I mean, what do you do?
Well, it's difficult. It's not easy. You know, again, Mrs. Coley, as you talk about all the barriers, there's barriers for getting crisis care. You know, if you don't say those right words that I want to kill myself or I want to kill someone else, then a lot of times there's either no space or you don't meet the criteria to receive inpatient treatment. But family members can, and those in the mental health field are aware of this, you can sign a petition and certificate. So the certificate, I believe, is just for, one of those is for the professional, and the petition a family member can complete. And basically you can take that to a court. So let's just say, for example, someone with chronic mental illness, you can file that, and that you're stating that my family member is incapable of making sound decisions for themselves due to mental illness. And you're filing a petition for them to receive treatment. This can also happen once they get in the hospital, but we also know it's hard to get them in the hospital, especially if they aren't at danger to themselves or someone else. So it's a challenge. I mean, it's a challenge. And we also know that sometimes, you know, those who prefer not to take their medication would prefer to be homeless.
I've seen that, yeah.
Yeah, exactly. So, you know, so it's difficult and it's not easy. There's not just one fix. I think, again, trust and finding out those protective factors. You know, if they don't trust the family member, then okay, you know, Pastor Steve is going to come pick you up and go someplace. And, you know, and if you trust that person. So if you can find that person who, the person who's suffering with their symptoms, will be more willing to participate, maybe be more willing to participate in their treatment. When they start treatment, signing those releases of information early on. Because if you don't, then it's like you don't know what's going on. You don't know what medication they're supposed to take, and they can keep any information from you. And we all know that as early as 12 years old, clients have the say-so in their treatment. So you can have a 12-year-old receiving treatment and withholding certain information from the parents. And so whatever way that you can, while still being on the side of the law, getting those releases of information signed saying, hey, you know, this is just in case an emergency. Can I call your mom? No, don't talk to mom. Okay, well, but what about your sister? Or what about your neighbor? Someone, so that when you see that person and you're recognizing that they are in crisis or more needs to be done, that you can reach out to that other person. Also, it's good to know that I believe the laws changed recently regarding those releases of information. Like if someone comes into the hospital who's chronically mentally ill and they don't sign the releases of information, you don't necessarily know about what's going on in their treatment, but the facility can call the family to say, John is getting discharged today, because otherwise who's going to come pick them up? You know, and so you have to know the law, you have to know what your rights are. And if the person on the other end might be confused about the law, maybe you have to educate them or say, may I speak to your manager? I don't need to know about their treatment. I do want to know what a discharge is and potential medication, because that is decreasing the opportunity for a crisis, and that is keeping that person safe by making sure they're going to someone's home so they can release that information.
Oh, wow. Elisa, you have a question for Dr.
I
Steiner?
do. I actually have a couple questions. So I wrote one of them in the chat. What does medication actually do for mental illness? And I put a couple examples, say, for instance, depression or anxiety. And then my other question, it has to do with the vaccination. And I know that we've had a lot of conversations here and through the community health workers about folks being anxious about taking the vaccination and how it can affect them. And I was going to pose the question, do any of you know if the vaccination has any relevance to our mental health?
And I am no medical doctor, but as far as I know, no. And from what I've been told and what I've experienced is if a person does not have adverse reactions to vaccines historically, chances are you would not have an adverse reaction to this. It will not compromise you just because you're taking other medications. You know, so your question is it contraindicated? Is the vaccine contraindicated to psychotropic medication? As far as I know, no. No. But again, if that person has a history of being sensitive to certain things like that, then they might be a risk for some symptoms, you know. But it's really, you know, again, finding a way to communicate to those populations in a manner in which they can receive it, as you guys talked about before. You know, how do you listen more to their concerns so that you can give them the information that they need and that they would be receptive to? Regarding medication, how does it help with depression? So there's two issues here with depression or anxiety with any symptom. Is it chemical? Is it biological and physiological, or is it environmental? So you'll have folks where, you know, because of the chemicals being imbalanced in their brain, no matter what's going on environmentally, they will feel an emptiness and they will feel the depression because they're clinically depressed and their symptoms are coming from a chemical imbalance. So medications can do great with that, right? Of course, you have to find the ones that's going to work well for you. But then if your environment is in disarray and you have a lot of stressors, then it's the combination of that medication and psychotherapy. How do you manage the fact that your rent is due? How do you manage the fact that you lost your job? Because medication is going to potentially help. A lot of people don't like it because the feelings that they actually do have, they numb them a little bit. So some people say they feel numb. And so they would prefer to be manic and having a way good time more than they would prefer to feel numb. And so it's important to, again, try the medication, see which ones fit, having a psychiatrist or provider who's willing to listen to that. So it basically targets certain areas of the brain and neurons and receptor sites so that it can produce potentially more chemicals and serotonin and dopamine so that things are more balanced up there. So that's how it helps. So sometimes when people are so depressed that there's not enough talk therapy to get through them, then definitely that medication may be a way to get them out of it.
Thank you, Dr. Steiner. That definitely helps to shed some light on it, right, Elisa? I think kind of gives us a better idea of, you know, how it helps, you know, and anything that can help people going through these difficult times is so important. So
yes,
important.
and just shortly, you wouldn't tell a cancer patient not to take their medicine. You wouldn't tell a person that has diabetes not to take their insulin. You know, so again, using a language that that person who's sitting across from you will understand. So your grandma takes her insulin, right? Right, you love your grandma, right? So how would you feel if she didn't take her insulin and she ended up in the hospital for Thanksgiving and couldn't cook you a turkey or that dressing, right?
Right.
So what about you? You don't need insulin, but you might need Prozac or you might need Seroquel or whatever it is, because it's a part of health. There's a mind-body connection there that all needs to be in a state of homeostasis so that we're at our optimal health.
I was a behavior specialist in high school, severely emotionally disturbed. That's an external kind of diagnosis as it may be. And one of the things that I struggled with was whatever that diagnosis was, it was exasperated by an educator who said, "You're not going to throw chairs. You're not going to spit." You know, they would just kind of load them up with suggestions that never manifested in my room because I didn't allow, you know, it wasn't an environment that was conducive to bringing that stress to them. But so, and some of them may have needed medication, but most of them just needed a safe space. In that season, we're talking about young people at that time, but you know, when you got kids.
Right. If I
Go
can
ahead.
share one thing about young people, and I think this is something that we can all use, and I don't mean to, take up, it is connect and redirect. And that can work in your home, that works with a police officer, that works with anyone who's speaking to anyone. Connect, then redirect. So you're right. You don't tell the young person stop throwing the chair, is that you try to connect with them to see what was happening that made them throw that chair. Well, and you're listening versus telling them to stop. You connect to see where they are emotionally, and then you redirect them softly by offering suggestions. Do you want to go to Mrs. Crawford's office, or do you want to go to Mrs. Wilson's office?
Yeah, kind of like damage control, right?
Yeah.
Well, I know we are winding down, and I appreciate everyone definitely tuning in and being part of our table talk. Does anybody else have anything to say? What about you, Sarah and Stephanie? I'm so glad that you guys were able to participate and give us information. I'd love to hear more about your agency, and definitely have it as a resource for the community health workers as we continue to help those that are, going through such a hard time. So thank you so much for being a part of this table talk.
I'm honored. So thank you for inviting me.
Thank you very much. And Sarah's at Nami, right? Yeah.
Yeah.
And I'm at Graceful Therapy in Oswego. So
Okay.
yeah, for sure.
Another
I can share
resource.
flyers. I can share
Another
flyers.
resource.
Yeah.
Yeah, we could share some flyers.
Please do, because since we covered, those regions and those areas, we definitely, need those services to, help the people that come to us, Yeah.
I'll
Can
put
you
my
all
email
share-
in the chat.
Yes, that's exactly what I was just gonna say.
Okay. All righty. Anybody else have anything else before we close? I'm just, again, just want to thank you all for being available.
Yes.
Thank you all for all of the information that you guys provided, and really just, being part of what Quad County is trying to do. And we're trying to be really instrumental in our neighborhood and our community. And it's people like you guys, the professionals that are definitely making a difference. So thank you so much for being part of our table talk. And hopefully, when we have something else, we would like to invite you to be a part of it as well. So Elisa, do you have anything to say after that?
No, I think you covered it all. I just would love to give my thanks as I'm letting Cheryl Woods Clendenning in into the meeting. I just so appreciate the conversation, and we really, as Barbara has said, are really trying to create just a table talk where we gather professionals and citizens and people in our community to gather around a table and have the conversations and provide the professionals who can answer questions that maybe they don't necessarily have the opportunity to ask. Like the one I asked was one that I've always had about what does medicine do for when you're having issues. So I appreciate all of your encouragement as well as your professionalism. And we will definitely have your names for future table talks. And they may not be related to mental health, but they may just be related to the things that we are trying to address in our communities where we know your voice will matter. So thank you again.
Thank you.
Yes. All righty. Thank you all.
Thank you, Barbara.
Oh, okay. Have a good night, everyone.
All
Good
right.
night.
Thank you, Barbara.
Oh, you're welcome,
Yeah.
everyone.